The person we have here is no other person than Dr. Ahmed Ogwell. He's the CEO of VillageReach. Please a round of applause for him.
Good morning. In the absence of protocols, life becomes a lot easier. So thanks very much, Francis, for dispersing the protocol part. Colleagues, distinguished leaders from all sectors, fellow champions of primary healthcare, ladies and gentlemen, a very good morning to you and welcome to the second edition of the Africa Primary Healthcare Forum. I think this is probably the forum that we need to really own as Africans, because primary healthcare is really the core of our health systems on this continent. Today, across many communities here in Africa, many families are making very impossible choices, and these impossible choices are made every day. A mother in northern Nigeria is delaying taking her child to the clinic because the transport costs is way beyond what she can be able to afford. A father in rural Malawi ignores the symptoms of hypertension because missing a day's wages will mean that his family will not eat. A grandmother somewhere in Kenya is working for hours to collect medicines that should ideally have been made available in her own community. These are not isolated stories. They are common across the continent and represent the realities of millions of Africans every day. These are failures of access to quality healthcare, and that is why I can stand here today before you with the conviction that the future of Africa's health will not come from our specialized and referral hospitals. That future will be decided in primary healthcare settings. Ladies and gentlemen, it is a tremendous privilege to join you here in Abuja for the second Africa Primary Healthcare Forum. I congratulate the organizers and the partners who have made this possible to convene what has become one of the continent's most important platforms for shaping the future of primary healthcare, not just here on the continent, but also beyond. The theme that has been picked by the organizers this year, Frontiers in Primary Healthcare, Technology, NCDs, Nutrition, and Sustainable Financing for Resilience, is timely. Note that we have given resilience context, and the context is technology, it's nutrition, it's non-communicable diseases, and sustainable financing. When we look at these four areas, they are not separate conversations. They are four lenses through which we must answer one very defining question. How do we build primary healthcare systems that are ready not only for our challenges today, but for the Africa of tomorrow? Projections indicate that by 2050, 1 in every 4 people on the planet will be an African. Our cities will be amongst the fastest growing over the next 2 decades. Our workforce will be the youngest in the world, and our innovation ecosystem will be among the most dynamic because of the youth of the continent. Yet, our greatest demographic advantage, the youth, could quickly become our greatest vulnerability if our primary healthcare systems fail to evolve at the same pace. Primary healthcare is no longer merely a health agenda. In my view, it sits at the core of Africa's development agenda. For decades, we in the global health space have organized ourselves around diseases. That is why we have built huge and often successful programs for HIV, for malaria, for tuberculosis, for Ebola, and even for COVID, which was a brief pandemic. We have even now started to build siloed programs around non-communicable diseases. These investments have saved millions of lives, so there's no doubt about that. And therefore, we need to recognize the role that they have played in improving the health situation on the continent of Africa. However, somewhere along the journey, we became very good at fighting diseases while investing far less in building the systems that are capable of preventing disease. We built vertical excellence, while horizontal resilience remained very fragile. Every major health emergency has reminded us of the same lesson. The COVID pandemic did not create weak health systems, it just exposed them. Ebola, which is giving us a headache right now, did not reveal gaps in surveillance, it revealed gaps in community trust. Climate change is teaching us the very same lessons, whether it is flooding, whether it is food insecurity, whether it is malnutrition or emerging pathogens or mental health. Every challenge eventually arrives at the same destination: primary health care. Strong or weak, the destination is always primary health care. This is not only where prevention begins, it is also where trust with the community is built. It is where communities first encounter the health system, and it is where resilience is strengthened or lost. Fellow champions of PHC, ladies and gentlemen, our continent stands at a turning point in public health history, one where international health financing is changing, development assistance is shrinking, and governments are facing growing fiscal pressures to be able to deliver on their mandate. We have spent a lot of time discussing these as uncertainties, but I tell you that I see these as opportunities for the continent. Perhaps for the first time in decades, Africa now has both the necessity and the freedom to redesign her health systems around African priorities instead of external funding cycles. This is our opportunity to move from projects to systems, from fragmentation to integration, from dependence to capability, from implementation to institutional building. And this is because resilience cannot be donated, it cannot be aid, it cannot be imported. It must be built, and it must be built by us. As we build this future, let me persuade you that there are 4 frontiers that we must embrace in this journey. The first is that prevention must become our greatest investment. Health systems should not be judged by how effectively they treat illnesses, how many sick people they see and process. Health systems, and realize here that we talk about health systems and not disease systems. Health systems should be judged by how successfully they prevent illness. With every child vaccinated, every pregnant woman receiving antenatal care, every family accessing good nutrition, every adolescent protected from preventable disease, every case of hypertension diagnosed early, and every community empowered with good knowledge. These are not just small victories, they are the foundation of resilient societies. The strongest health system is not the one that treats the most patients. It is the one that produces the fewest preventable illnesses. Let us not just chase disease, let us produce health. That is the first frontier. The second frontier for me is that technology must strengthen people, not replace people. We have seen how data can revolutionize decision-making when available in time, how digital platforms can transform surveillance, how digital supply chains improve commodity availability at the last mile, and how artificial intelligence can transform healthcare. However, technology alone cannot create the trust that we need to build health systems. As we embrace the transformative potential of technology, we must remember its limits. Technology can process data, but technology cannot comfort an anxious mother awaiting news about her sick child. Technology can generate reminders so that we do things on time, but it cannot build the trust that gives a parent the confidence to take their child for vaccination. Technology can support clinical decisions, but it cannot replace the wisdom, compassion, and the lived experience of a community health worker who understands the nuances of the people that they serve. Technology is therefore, for me, not the destination of primary health care. It is an enabler, and an important enabler, for a better, more efficient primary health care systems. The future we seek is not one where healthcare is simply digital, but one where it is digitally enabled, human-centered, community-driven, and unwaveringly focusing on equity. That is the second frontier. The third frontier, communities must become co-architects of the health system. One of the greatest mistakes we continue to make is designing health systems for communities rather than with them. Too often, we organize health services into separate vertical programs and expect communities to navigate from one program to another, from one project to another. But communities do not experience health and illness in silos. A mother does not separate her child's immunization from good nutrition. A family does not distinguish maternal health from management of chronic illnesses, or mental health from infectious diseases. To the people that we serve, health is one continuous experience, and our systems must be designed to reflect that reality. At VillageReach, we have learned over the last 25 years of our existence that the most sustainable solutions are those that are shaped with the communities that are intended to be served. When communities become co-designers rather than passive recipients, they develop a sense of ownership. Ownership builds trust. Trust encourages people to seek and use health services. And when people use health services consistently, we achieve what matters the most: lasting impact. The fourth and final frontier for me is that sustainable financing must become political and not just a technical discussion. We need to change the way in which we think about financing primary health care. Too often, our discussions on health financing are confined to us, technical people, to economists. They are confined to budget analysts, confined to what we, from the health side, discuss with the ministries of finance. Sustainable financing is not merely a technical exercise. It is ultimately a political choice. It is the choice to invest in prevention before paying for a crisis when an outbreak comes. It is the choice to strengthen community health today rather than bear the far greater social and economic costs of major illnesses tomorrow. Primary health care is not a recurring expense on a government balance sheet. It is one of the smartest investments that a nation can make. Every investment in strong primary health care yields good returns. Healthier children who are better able to learn, healthier adults who are more productive to the economy and society, stronger communities that are more resilient to shocks, and economies that are better positioned for sustained growth. Health is not in competition with economic development. In fact, it is one of its most powerful drivers. Countries do not become prosperous and then invest in health. Rather, they invest in health, and in doing so, create the conditions for lasting prosperity. So let's remember those 4 frontiers: prevention as our greatest investment, technology to strengthen people, not to replace them, communities as co-creators, and sustainable health financing as a political imperative. Ladies and gentlemen, as I conclude, there is one more frontier that we must confront, and perhaps it is the most important one of all of them. It is not technology and it is not financing. It is leadership. Technology will continue to evolve. Artificial intelligence will become even more powerful. Medicines will become more effective. Diagnostics will become faster and more precise. These advances will not deliver their full promise unless our leadership evolves with them. The future of primary health care will ultimately be shaped not by the pace of technological innovation, but by the quality of the decisions we make as a result of that innovation. It will require the courage to integrate where today we are duplicating. It will require the courage to invest in resilient systems rather than short-term projects. It will require that we trust communities as co-creators and partners rather than merely as beneficiaries, and to make decisions that look beyond election cycles to deliver on generational impact. It will also require the courage to recognize that no country can build a resilient primary healthcare system in isolation, because diseases, unfortunately, do not stop at national borders. Africa's future will increasingly depend on our ability to work together through stronger regional cooperation, the sharing of surveillance systems, strengthening of local manufacturing, exchanging knowledge and innovation, and holding one another accountable for the health of our people. In an interconnected continent, as we are building today, resilience is not something that we achieve alone. It is something that we build and sustain together. Allow me then to conclude by asking you to imagine an Africa where every child begins life connected to a trusted primary healthcare system, where every community health worker has digital tools that improve and not complicate the work that they are doing, where no woman dies giving birth simply because quality healthcare was too far away to access, where nutrition, immunization, mental health, chronic disease management, and emergency preparedness are all functions through one integrated system, not siloed and vertical programs. An Africa where governments use real-time data to anticipate outbreaks rather than to wait and then respond to them, where communities trust the health system because they helped to build it, where primary health care becomes the engine of Africa's prosperity. This future is not a dream for me. The science exists, the technology exists, the evidence exists, the institutions exist. In fact, looking around this room today, the talent also exists. Partnerships that we have created around primary health care also exist. The only remaining question for me is whether our collective ambition is equal to the opportunity that lies before us. Excellencies, ladies and gentlemen, history will not remember us for the wise and eloquent innovations we are going to make in Abuja. It will remember whether the decisions that we make have transformed the lives of ordinary Africans, whether they reduced inequity, whether they strengthened resilience, whether they brought quality care closer to every family on the continent. History will remember us whether we built health systems worthy of the next generation, because ultimately, Africa's future will not be determined by the sophistication of our tertiary hospitals. Africa's health future will be determined by the strength of the clinic in the village, by the confidence of the community health worker, by the resilience of our supply chain, by the trust between governments and her citizens, indeed, by the courage to invest in prevention before a crisis. The next chapter of Africa's health history will not begin in a laboratory, neither will it begin in a parliament or even in a boardroom. Africa's next health story is going to begin at the primary healthcare level. Because when we build primary healthcare systems well, we do far more than improve health. We unlock this continent's greatest asset, and that is its people. Let us build Africa's future through a strong and resilient primary healthcare system until we are all safe. I thank you.
Thank you, Dr. Ahmed, for your goodwill message.